Welcome back to the program. Good morning, Sierra Leone. Now let's quickly take another important issue. In commemoration of World Mental Health Day, the Sierra Leone Association of Social Work has called on government to prioritize the creation of an enabling environment for youth employment and job creation to combat KUSH abuse. The association described the abuse of KUSH as an alarming one that creates such destruction in the mindset of youths. Now, UMU Jalloh is the financial secretary of the social work lecturers at FBC. Good morning and welcome to the program.
Good morning viewers.
Now, I certainly understand this need to, as we've been talking here, Charles Mambu and Mr. Neno, we are all going to put hands together to actually create a place, Sierra Leone, that is filled with employment. But certainly before we actually do that, the youths that are involved in taking KUSH, they must first of all be talked to, and they certainly need to go to rehabilitation centers to actually get them off the KUSH, because if they'll be working in this agricultural sector, they'll just be taking this money to feed their drug abuse business. So first of all, what exactly has your organization been doing so far as to maybe talk to the government for the establishment of this rehabilitation center and talking to the youth themselves for them to stop this habit? I know it's not an easy habit to kick off, but constant talking to will certainly get them off their drug abuse.
Yes, thank you very much. So even based on the discussions that were already happening, like I had so much insight that I thought was key to what I was about to discuss.
Okay.
So when we look at development of a nation, we have different components that ensure sustainability. We have the economic side of it, and we also have social development, which is key for us to focus on our youth, because they are the major players, they are the major employees that the government will be targeting, especially when you talk about the field of agriculture, going to the field and cultivating. So our organization is looking at addressing these issues and ensuring that the voice of the youth are heard. So most of the time when you go to communities, you have discussions with drug users. Most of them start abusing drugs in a way to take their mind off their problems or take their mind off what is disturbing them.
And escape from reality.
Exactly. And most of them are unemployed. So we've had workshops wherein we want to focus on public awareness, make people aware of the dangers of these drugs, because most of the youth start partaking drugs without awareness of what addiction is. So they assume that I can stop when I want to. And when you look at how the chemical formats of most of these drugs are, they develop dependency on these drugs. So we are calling on governments to look at how they'll focus on rehabilitation of these youth, and also raising awareness that drug users are part of our society and they have their impact, whether it is positive if we address the issue or negative. Because like you said, if I become employed but I have drug issues, I will still sustain the drug problems, and rather than focusing on my own personal development, which in a way affects the national development. So we had workshops in communities wherein we went to discuss on harm reduction, on how we talk about how to use the drugs in a way that it reduces harm, because as I said, most of these youths are now addicted. And when we talk about rehabilitation, you cannot stop cold turkey like you normally say. You cannot say, okay, today I'll stop using drugs and immediately you stop. So we look at how we address this issue in a way that we create consciousness, okay, about how effective these drugs are at disturbing the mental health of the youth. And like I said, when we look at development, if development is just focusing on the economic side and we neglect the social development part of the development process, then most of our efforts will be redundant. Mr. Mambu was talking about continuity, citizens owning development. This all comes with public awareness and also making the youth aware that the development is in their hands, and when they focus on the right things, then they'll be able to spur further progress in their lives.
Right, you mentioned something that is very important, not stopping cold turkey. Now, I don't know if they understand much about that, because like you said, they will just go into this drug take abuse and say I can stop whenever I want, and usually they don't get to even stop. And when they actually want to stop, their physical appearance, they're not even active that much, because they've grown dependency on this drug. So understanding must be brought to them that you cannot just leave the drug as you want. You have to just be taking it in smaller doses to the point where you have relieved yourself, your system is relieved of it. So I don't know how you've been working with maybe doctors or people that have much more ideas to that, to bring that knowledge to them.
Yeah, so for now we are a new organization. We are working on legislation for our organization to be accepted, and also currently they are working on an act to formalize social work practice in Sierra Leone. So like I said about the cold turkey idea and the idea of drug dependency, most of the time if you look at the trajectory of drug use in Sierra Leone, since during the war period, there has been issues of drugs. So at one point it was marijuana, then it shifted to pills, and when that is regulated, you know, the youth always find the next excuse or the next drug to use, because in their mind that is the only escape that they have. So there is less focus on educating them that there are alternatives on how to address your problems. Because when you have stress and you start talking about your stress in Sierra Leone, everybody, the first instinct is to tell you, we are all stressed in Sierra Leone, we all have our problems, focus on your problem, you know. And people do not give the issue the importance that it has. And most of the time when they bring up solution, it's just talking about abstinence. That is what most of the regulations focus on. That if we catch you smoking, we'll arrest you. If we catch you using drugs, we'll arrest you. So at the end of the day, when you ban one particular drug, you notice that another one comes up that makes the growth of drug abuse is increasing. And it's not only in Sierra Leone. When you look at the global map, you know, you look at how trajectory of drug abuse is happening. It's happening very frequently in the world. So right now, that is why mental health advocates are looking at how we discuss harm reduction, how we discuss how these drugs are affecting us, okay, and how we can manage it in a way that it does not affect our normal functioning. So that is what we are advocating for.
Now, Umo, there is such a, apart from those who actually take this drug seeking some sort of escape from reality, there are those that are actually working. They are, because there certainly have been videos on social media where you see someone in their uniforms and they are working at a particular institution, but yet they're taking this thing. That is not, they are trying to just, maybe they're going through depression. That's something that is been very rampant nowadays, depression. You find someone very young or old or in midlife crisis, they'll be going through this depression. Mostly what they need is someone to talk to. Now in the West, they have a whole system for that. They have therapists that they actually talk to. They schedule therapist session, they talk their problem, and these therapists help them to cope with their problems. But that is not seen in Sierra Leone, although we have massive amount of people who study social work. I don't know if your organization is do you want to be focusing on that area, so as people will be getting to talk about their problems, and it'll help them find coping mechanisms, so to speak.
Yeah, so our organization basically is a form of a regulatory body, like we have the Sierra Leone Bar Association, you know, and the doctors have their own organization. So for us as Sierra Leone Association of Social Workers, our focus is on registering social workers and, you know, tracking progress of social work education in Sierra Leone. Okay. But when we look at what to target, we targeted this particular issue specifically because it is World Mental Health Day on October 10, and we agreed that we should focus on the national theme, which is mental health in an unequal world. And when we look at how things are going, especially in the country, the gap between the successful and the less successful is very, very huge. You know, you will notice that majority of the youth do not have someone to talk to. And when we talk about mental health issues, now our National Psychiatric Hospital is well equipped with trained psychiatrists, wherein they are focusing not only on talking, but some of these mental issues need medication. Okay, so for example, like depression, you can take antidepressants if you have chronic depression, wherein you move on to a manic state. So we have experts now in our health system that are mental health experts that know how to diagnose and also to treat with both therapy and medication. So we just need to bring the awareness to the population, because up till now people are not even aware of the services that have been added to our health system on addressing mental health issues. So we just think that when they talk about mental health, it's just somebody that's on the streets that is maybe dressed bad and maybe they are unkept and all that. But we have people that are functioning, like you said, they have jobs, you know, they have families, they have what we might deem as the perfect support system, but at the same time they are going through some mental issues like depression, or we have bipolar, we have schizotypal issues, wherein you can function and disguise your actual mental health problem. So we are focusing on bringing advocacy to society to be aware that being a person with mental health issue does not mean you are not part of society, but rather for us to realize that mental health issues are part of our daily existence. Because for today I might be normal and everything is okay, and maybe tomorrow I might be involved in an accident, I might lose my job, I might lose a family member that will immediately affect my mental health, and I need to know who to talk to and what is the expectation that I should have from them. Because these are all the excuses that people are giving for partaking in such harmful drug use.
Alright, Jalloh, you write on there, Jalloh, the Financial Secretary, SLASW, and a social work lecturer at FBC. We'll swing right back to you on coping mechanism talk. A reminder to you, my viewers, this is the Good Morning Sirene program from your national broadcaster. We take another issue